Hello, everybody. We're going to wait just 1 minute to get started. Thank you all for joining today. Hello, and thank you for joining our thought leadership session today. The future of healthcare is beyond the digital front door. It's time to rethink consumerism. My name is Nisha Bagapelli, and I'm delighted to present today's panelists. From Be Well, a company that's working with healthcare organizations to deliver a unified consumer experience to their populations, we have CEO and founder, Kristen Valdez. Hi, Kristen. Thank you for joining today.
Hi, thanks so much for having me.
And also from Be Well, we have the Chief Technology Officer, Imran Qureshi. Hey, Imran, good to see you.
Yeah, nice to be here.
And from Damo Consulting, we have CEO and founder, Patty Padmaban. Patty, thank you so much for having us.
Thanks, Nisha. Thanks for having me.
Patty, Kristen, and Imran, thank you for joining us today. Today's topic is very timely with the amount of disruption that's occurring in the healthcare market. Big retail vendors like Amazon are swooping in and acquiring healthcare companies, and recent consumer studies are verifying that consumers want the convenience and accessibility that these retail giants are offering. So, to help kick off today's session, we'd like to start with a poll to hear from you. So, are today's technologies ready to enable consumers to make them more informed, help them make more informed decisions and navigate them to the appropriate care? We'll give just a minute for everybody's answers to trickle in. All right, I think everybody's ready. And an overwhelming amount of you said no. Kristen, what are your thoughts about these results and consumer expectations? And what do we really need to be aware of?
So I think the healthcare industry is still largely getting ready for the creation of what we like to call the shoppable healthcare consumer. It took a number of sweeping regulatory changes, in fact, 32 that we're tracking, in order to make this happen. And I think there's a lot of folks that are just simply not yet educated around what the power of those rules mean. And I think technology companies, as well as healthcare stakeholders, have been working to integrate the changes that have been brought on by these regulations into the technologies that they serve. So while I think we're on the early side of being able to provide consumers with what they are looking for, I think that over the next 2 to 3 years, we're going to see some really transformational change in the tools and technologies that are offered to consumers as a result of key legislation like the information blocking and interoperability rules that now grant consumers the right to allow any trusted third-party application of their choosing to help them aggregate and collect all of their health information in one place. We know from statistics that consumers want their providers to have access to information about all of their diagnoses, all the prescriptions that they take. We know that consumers want transparency in price and choice on where and how to receive care, whether that's in person, virtual, or digital. But before these regulations came about, we didn't have accessibility to APIs to gather and collect that information, whether it was for something as simple as having an updated provider directory to even find care or have access to pricing on common procedures in health, or to even have access to their own healthcare information beyond the limited information provided in a portal. So I think what's happening is big tech and retail are realizing that they've built successful companies on the backbone of being consumer-led organizations, and that there's a real opportunity in healthcare to achieve loyalty by giving consumers what they're looking for, which is access and transparency to all their health information, personalized communications, and then simple navigation for accessing care for themselves and their families.
Thanks, Kristen. So I can imagine that once we give consumers choice and create that transparency, there might be the implication that people will start to provider hop, just like they do when they're booking their next vacation. Sometimes I book it in Southwest, sometimes I book it in Delta. It really depends on how it's convenient to me. So Patty, this might create a whole lot of mismatched data. What do you think can help solve that problem?
Well, firstly, I think there is a gap that needs to be addressed in providing consumers with the choice that they're looking for, providing them with easy, convenient, and reliable access to services and to the choice in the services, whether it is, in selecting a provider, as you mentioned, or in any other, maybe, payment options and a variety of things that go into creating this online experience for consumers that they're used to in other sectors from a shopping standpoint. But healthcare is also different, and it's not easy to create that experience. Kristen referred to some of the challenges, the data side of things, and we're going to be, there are other things that presumably we'll talk about later, such as creating an identifier so that even providers can identify patients and serve them, a targeted and reliable way. The good news, I think, is all the health systems that we work with in my firm, and also all the research that we've been doing, points to this being one of the highest priority focus areas for health systems. And so that is good news for consumers. And presumably, it's also good news for technology solution providers that can help solve this problem in a reliable way and in an accelerated way.
Yeah, I really appreciate that. I mean, I think that, one of the things that, Imran, I know that you and I have talked about quite a bit is how a lot of the clients that you talk to on a daily basis are seeing that, there's these digital front doors that they're calling that they've invested in that has bringing to a lot of some of these, the things that we're talking about, the features that we're talking about to the forefront, but there's still something missing. Can you, Imran, maybe talk a little bit about your experience with working with clients and what you're seeing so far in the marketplace?
Sure, Nisha. So the digital front door that we talk about in the industry is typically a patient portal. And patient portals, while they add value, are not what consumers are looking for. As Kristen and Patty mentioned, consumers want personalized, affordable, and convenient care. But the patient portals today, they just offer users a subset of the data that exists in the electronic medical records. And that's why 90% of the providers provide a patient portal today, but really only a third of the patients are actually using them. And when we talk about patient portals, we really have to use the word plural. So today I have to go to a patient portal for my health information. My wife really liked her gynecologist, so she goes to a different provider. So I have to log into that portal to get that information. I then have to go to the portal of my physical therapist to get that information. Then I have to log into the Walgreens portal to get the information about my vaccines and my medications. And then I have to log into the LabCorp portal to get my lab results. And then finally, I have to log into my insurance company to get all my claims. So Kristen's coined the term portalitis to explain this condition where consumers have to go to all these various places just to get their data. And if you think about it, a typical consumer only has 20% of their data in any one of these systems. And so if a doctor is providing you care based on only 20% of your health picture, that's not going to be very effective. And as a society, we've gotten more and more used to digital tools. If you think in your life, how much you use Amazon and all the other digital tools you have, and especially the newer generation, such as the millennials, are growing up and they're demanding more. And in fact, 40% of the patients who switched providers recently actually did it as a result of a poor digital experience. So when we look at with our clients, it's really the world is moving away from just a patient portal providing you information about your data in that health system to really a true digital experience that provides consumers personalized, affordable, and convenient care. And as a result, the consumers are making choices on which providers they take their business to, depending on what that experience is.
Well, and I think to add to that, when we talk about digital front doors, there's this underlying assumption that healthcare has had for a very long time, which is that the consumer already knows they need care. So we're waiting for them to come to us. And the reality is that the war to be won is by reaching out to people in anticipation of something that they need and giving them information that can help keep themselves and their families healthy. And when we talk about portalitis, it's more complicated than just my access to my information. It's estimated that data is now in 70 to 78 different locations for an individual. But 86% of healthcare decisions in this country are still made by women, and they caregive to their children, sometimes to their spouses, to their parents who are now generationally living longer and aging in place, and all of their portals that need access. And so we have this, lack of a comprehensive consumer health record, but we also have the complexity of having to bring that data together and normalize it to create the 360-degree view that's required to get upstream and start to anticipate a consumer's needs, not just react to them and assume that they will continue to come to us. And I think that's where a good entry point for healthcare and retail or tech and retail companies can come in, because they're really good at anticipating and offering new value-based benefits and reasons to come in and draw people into their organization from a convenience standpoint.
Thanks, Kristen. I mean, it seems like there has to be some sort of, whether it's a vaccine or an antidote for portalitis. And it might end up being some sort of digital patient engagement of the future. I mean, Patty, you talk a lot about this, I think, in some of your thought leadership as far as what's going to help solve this problem in the market, in the future. What are your thoughts there?
I think there is a combination of what you offer at the front end enabled by what you need to do at the back end. So let me give you an example of that. So when you talk about digital front doors or a patient portal where you're offering a number of services and features to your consumers, you need to make sure that those features are really effective for the consumer and effective for the organization too. Our research shows that while there's a lot of work being done to create this convenient and reliable access through a patient portal, through a mobile app, those kinds of things, the fact is that the individual functionalities, there's a big variation in how well these individual features work today. And it's not necessarily to do with the portal. Let me give you an example. Online self-scheduling, for instance, is a very high value use case for providers and for patients. And our research shows that it's one of the highest priority focus areas for providers, but it's also one where the performance of the existing features in whatever tool they have to offer this capability is far below their expectations, right? So there's a big gap there. So it's one thing to have an online scheduling feature. It's another thing to make it work and work well both for the providers and the patients. So that's just one example. So you'll have to go through this entire list of what you're trying to offer to your consumers through your portal and make sure that you're set up to offer it well and deliver an experience that's going to make the consumer come back to the portal. Because if they don't get the scheduling experience that they're looking for on the portal, what are they going to do next? They're going to call the call center. And that's exactly what you're trying to avoid by using the portal. So it's nothing to do with the portal. It's to do with creating an ecosystem and creating an experience that takes into account the front end and the back end.
I agree with that completely. It's so funny. And Imran, I know you have a lot to say about this as well, but we've, gone into health systems where when somebody does show up looking for an appointment, they were experiencing, 20 to 30% conversion into actually achieving the appointment that they came looking for. And the experience is really important. So when you think about traditional EMR portals, you can go and look for your doc, you can try to schedule an appointment. But if your doctor's not available for 6 to 7 weeks out, 70% of people are abandoning that workflow and they're going somewhere else for care that's more convenient and aligns to their timelines and their needs. So some of our more innovative health systems who are now getting, over 85% conversion of people showing up is because they've created concepts that create almost waterfall approaches, but it means that they've had to shift culturally. So when the doctor that someone is searching for is not available for 6 to 7 weeks out, they're automatically showing, but who's the next available doctor in the practice who can see you? And if they're not available, here's a same day e-visit appointment that we can guarantee for you today, or you can access our telehealth solution right now. And so it's more likely that a consumer will stay with you in the example that Patty raised by creating a delightful experience that meets the consumer's need, even if it shifts the complexity around how your workflows operate today, meaning most doctors don't want you to break the patient-provider relationship. But if you want to keep that person from going into a retail clinic down the street and breaking it anyway, you want to keep them within your system. Sometimes you have to be a little bit brave and think about how do we meet their needs, not just think about the way that we have traditionally used workflows to drive people into care.
Yeah, I think that's perfectly correct. And a couple of things to add to that is, I think there's one scenario of making an appointment with a doctor you already have, but then there's also the scenario of finding a different doctor, a different specialist. So that has to be part of the online scheduling experience. And then once you've made an appointment, that is usually not the end of it. In some cases, you may need to reschedule it. Some cases, you may need to cancel it. And then there may also be a workflow you need to go to in terms of filling out forms and stuff before you show up at the doctor's office. So I think when we think of online scheduling, we have to think about it in totality, like Patty was saying, not just about making appointments with your existing doctor, and also making sure that we do the whole workflow.
And the type of care that you're seeking also makes a difference. Is it a primary care visit? Is it a specialty visit? Is it an urgent care visit? That also makes it. So this is a non-trivial challenge for health systems, and creating the intuitive front end for the user is one part of it. Like I said, there's a whole lot that needs to happen, and it's almost like the portal is the tip of the iceberg. Everything else is underneath, and unless you get the back end right, you're risking all of your investment, because if you're not able to move the needle in terms of patient behavior and consumer behavior, then you have a problem on your hands.
Absolutely. I think we make it too complex. When we think about even finding a doctor, consumers don't know what specialty they need in many cases, nor do they know necessarily how to even spell some of those complex specialties. And they certainly don't know the rules around who is open for scheduling, underneath that specialty, or who has experience in the condition or the expertise that consumer is looking for. So when we think about even provider directories and finding care, there is a whole transformation effort there. I mean, the federal government had to pass rules and regulations just to have provider directories updated more frequently, because they were estimating that 50 to 65% of them were completely out of date and inaccurate. And that was just limited to name, address, specialty, accepting new patients or not. Where what consumers really want is, well, does this doctor offer telemedicine? Will they text message with me? Do I have access to receive my results? What is the average time for care? And if, let's say this is a neurologist, do they have experience in the kind of maybe migraines that I suffer from, versus are they surgical? Consumers don't have access to any of that information. And that's why the overwhelming majority of people, when looking for a new physician, ask a friend. So we're not giving them the information that they need today. But I agree with you completely, Patty, that how you structure and reorganize the underpinnings of your operations matters to drive the right consumer behavior.
And I think we have to expand the definition of provider too. Like, there's wellness programs that are being offered by employers. There's labs, there's pharmacies, there's virtual health that you talked about, there's asynchronous health. So really, as we talk about giving consumers choice, we need to have them have the ability to choose from all of these various options to whatever is most convenient and affordable for them.
I think convenient for sure.
Yeah, and this brings up an interesting point, and it's something that I know that Kristen, you and I have talked a lot about this debate between there's sick care, there's I need to find a provider because I have a problem with X, Y, and Z. And then there's this whole notion around well-being and, how to engage folks when you just, you're trying to make sure that they just know that tool is there for you, because that part might not necessarily mean that you might need to engage with that tool every single day. That every single day I log on and I need to, take a test or take an assessment. So how does the market differentiate between, there's the sick care, there's the well-being, or are we supposed to treat those folks two different ways? How do we make sure that there's quote unquote personalization that happens in which we're activating them to want to do something and want to engage with them when it's available to them?
Yeah, it's funny. You hit on one of my favorite topics, because there's definitely still companies out there that are selling based on daily active users. And I always tell people that we've known in healthcare for a very long time that the fastest way to disengage someone from a healthcare solution, especially someone living with chronic illness, is to remind them that they're sick every day. And so when we think about what consumers really want, it boils down to two high-level things. Be there for me when I need you, and tell me when there's something I need to do. And for God's sakes, please keep it simple. So, the reality of the situation is that from a consumer perspective, we are used to things that are tailored and personalized to us. Many of us have weather applications sitting on our smart devices, and we get pop-up notifications that let us know when a storm is in our area. It's unique, it's personalized to us, and it's looking at our geolocation. We don't have those same kind of experiences in healthcare. When was the last time somebody popped up a notification or called you and said, hey, happy birthday, time for that colorectal cancer screening, right? Now, people don't really want that message on their birthday, but the reality is that you could go ask 9 out of 10 people on the street, when was the date of your last tetanus shot? Or what was the date of your child's last tetanus shot? They're not going to know. When are you due for a mammography? When are you due for a colorectal cancer screening? When are immunizations due for your kids? When was the last time mom or dad followed up with the cardiologist? Or did you know that living with diabetes, they really need to see a podiatrist as well? One of the lesser known evidence-based medicine guidelines that people don't follow. So there's a lot of opportunity for us to use the same kinds of learnings that came out of the post-internet era, and the digital revolution and all other aspects of our life, and personalize experiences down to an individual level, where we're saying it's time for your child's, and using their name, immunization. It takes about 30 days to get into your pediatrician. So it's time to book that appointment today. That's knowable information. And it's something that we haven't leveraged or utilized for consumers in the past. But we do want to give them those happy birthday messages. And we do want to give them a checklist of to-dos so that when someone's logging into see not just what is needed for me as a consumer, but what's needed to keep my family healthy. And should I be making an appointment? But if you're going to tell me someone needs something, give me the action item that goes along with it that allows me to mobily schedule or cancel or reschedule or manage my calendar in a way that's convenient, but give me choice in case the one pathway you're giving me is not convenient and doesn't fit into my world. So if you're only open to book an appointment and all your docs are called to book, but you're only open from 9 to 5 and you're closed during lunch, for people with full-time jobs where they don't have the luxury of having a phone on site unless they're on a lunch break, that's not going to work for them. So being able to bring that convenience, I think, is really important. And we tell our clients and customers all the time, you really need to think like a consumer, even if that means partnering to bring services you don't offer today into the fold in order to meet the consumer's needs so that you have their back and you are there for them when they need you.
I see this also as a matter of understanding your population and your case mix, or your payer mix, as the case may be. Most health systems have some combination of commercially insured populations, Medicare populations, Medicaid populations. Some tend to be overweight on one or the other. An urban destination hospital looks a lot different from a rural health system that is mostly serving Medicaid populations. And what the needs of those populations are can very much drive your digital priorities and your consumer engagement platform choices. So if you're serving a predominantly Medicaid population in a rural community where you have maybe technology challenges, bandwidth challenges, maybe you're in an older generation of devices, and you have a very largely chronic, population with chronic conditions, multiple comorbidities, and the way you engage with them is going to be very, very different from how you're engaging with a population that is young and healthy and is focused more on wellness and so on and so forth. So I think designing these programs, there's no cookie cutter approach to this. How you get paid ultimately in healthcare, everything is about following the money. How you get paid makes a huge difference in what you choose to invest in and what is important for your organization. Again, that's a whole big topic in and of itself, but I just thought I'd mention that because your choices will have to be necessarily driven by what your populations look like and how you're getting paid.
Oh, absolutely. And Imran, I'm actually curious about your opinion on something. Sorry, Nisha, for derailing. But I've got an interesting question for Imran. when we have historically looked at solutions that are offered inside of the healthcare delivery system, they tend to be kind of off the shelf, kind of one size fits all. And we've talked about this N of one personalization. Patty just talked about the fact that, your Medicare and Medicaid populations, especially if you're in serving a wide, diverse community with varying levels of access to certain kinds of services, doesn't necessarily mean that you need multiple tools. What it does mean is that you have to expand your knowledge of what I like to refer to as a user profile. Can you talk a little bit about what the data tracking around an individual needs to now contend with that you've seen having built out these models, and how that relates back to, the golden record or privacy, security, consent, or even the types of programs and solution offerings that you give to individuals?
Yeah, I think it's a really interesting topic. It's sort of the transition away from cohorts to the N of one. So typically in healthcare today, we look at diabetic patients and we say what to do about diabetic patients. We may look at cardiac patients and what to do about cardiac patients, or high-risk pregnancies and what to do about that. But the reality is that no person actually fits cleanly into any of these cohorts, because there are people who are both diabetic and cardiac. There are people who may be pregnant with those conditions. So really what we found to work much better is to analyze everything as a patient at the N of one, and then roll those up to create cohorts that we can act on. And that way we're identifying what each person needs and using that to figure out what the population needs, rather than looking at the population and then trying to transfer that over to the patients. And that approach we found to work really well in various populations, such as Medicaid, Medicare, commercial population, to be able to get the actions that we need in that population.
Patty,
that.
I'm curious, sorry, Nisha. I was curious what Patty's thoughts were around the security and privacy of this data, and when it pertains to like the golden record and identity, because I know that you've done a lot of conversation around that. And then Nisha, I promise stopping to steal your next question. Yeah. I know you're trying to move us on, but it's a fascinating topic.
Yeah, they are related. So the two topics you just mentioned, they're related but independent, right? Security and privacy in general is a big deal in healthcare, especially now with, patient data. And I will start by saying this, and I've said this before, consumers are in a losing battle when it comes to the privacy of their data. There is absolutely minimal to no protection for how their data gets used, how it gets spread, how it gets harvested in the multiple different, it is a losing battle. Now, I won't go into what can be done about it. That's a topic for a different conversation. But there are a lot of things that health systems in particular are doing, recognizing the need not just to protect the privacy, but also to make sure that you're engaging with your patients in a way that is appropriate and is also in alignment with how patients want to engage. So you talked about the golden record, for instance. The golden record is a huge gap right now in healthcare. Most health systems don't have a reliable way of identifying their patients, especially, and we worked with integrated health systems that have a health plan and they have a health system, and then the member and the patient, they don't know how to necessarily match the two in a reliable way. And then you have you replicate the systems to engage with the member/patients, and sometimes you can't even recognize someone showing up at your clinic registration as a member, right? And so how do you address these gaps? You create a golden record, and the golden record serves multiple purposes. One, of course, it helps you to unify all of your identifiers into one record, which helps you to engage with the patient, whether it is for clinical needs or just simple communication needs. Communication preference is a huge deal today. Patients want to be, today we're in an omni-channel communication world, texting, web, phone, chat, whatever. And they all have, consumers have distinct ways or preferences for how they want to be contacted. And you want to have a system that allows you to record these preferences and engage with consumers in the appropriate way. And the golden record is an enabler to doing that. But the golden record enables you to do much more. It allows you to target your cohorts, to your point, Imran, to create audiences and to be able to reach out with very targeted messages, whether it is for their care management or whether it is to sell them new services. So this is all right now, these are very high priority topics for all the health systems that we work with. And I think the urgency for addressing these has kind of risen a notch because we have big tech, big players coming into the space with advanced and sophisticated capabilities for managing exactly these kinds of MDM type problems, if you will. So it's going to raise the bar on expectations from consumers. It's going to raise the bar on performance by all the incumbents. And hopefully it's a rising tide that lifts all boats and ultimately benefits the consumer. So that's kind of how I look at it.
I think one thing to add to that is consumers think of security and privacy a little bit differently. I don't want my data locked in some room where I can't even get to it, nor can I let anyone else get to it. So I think in terms of privacy and security from a consumer standpoint, it's more about I want to know what my data is and I want to be in control of who it's being shared with. And so I think it's really the portability aspect and the control that's very important to consumers. And as long as we can provide that, consumers are very open to having their data shared with people that they choose to share with.
I'm going to go out on a limb here and say not so sure that they don't care about who gets access to the data as long as they get access to their own data. I think they care about getting access to their data, but I also think that they care about who gets access to their data, especially sort of the insidious access that consumers are not informed about in an explicit way. I think it is a hot button issue. I think it is a very sensitive issue, and health systems that I work with are very sensitive to the fact that that the tech world maybe thinks about it a little bit differently, and so I think there are some gaps there.
For sure. I mean, I think informed consent is going to be a topic of conversation that is going to continue to heat up over the next 1 to 2 years. Organizations like the Karen Alliance created a Karen Code of Conduct that third-party app developers are attesting to, and they're putting out there transparently when and how data and information is stored and shared. I mean, at BeWell, we've taken the position that we don't advertise to people based on their data. We don't sell their data. We don't aggregate, their data and give access to anyone. So under the patient right of access, we've taken a very hardline position of making sure the consumer knows that their data is controlled. But I think for far too long, the healthcare delivery system has really hidden behind HIPAA. And under HIPAA, under business associate arrangements, consumer data can be shared with all kinds of downstream entities outside of the consumer's knowledge. We saw some uprising with some very big, partnerships where consumers didn't like that there was partnerships with big tech, Google and Ascension partnership, which was all perfectly legal. But the reality was that consumers didn't like it and they didn't consent to it. And I think in order to win consumer trust and loyalty moving forward, that all healthcare entities are going to have to think differently about commitments and transparency to what consumers are signing up for. And I think that's why Imran stated, and I agree with him that it's important to let consumers know and always be able to see when and how their data is shared and with whom and for what purpose, because consumers definitely will share their data as long as they understand, when it's going or who it's going to and for what purpose and what value they're going to get from it. More and more frequently, they're feeling more confident in that, but they also want the right to revoke. We want consumers to be able to try new, different solutions. I mean, there's 300,000 digital health applications on the US cloud today, and that number grows by 2 to 250 per day. So at some point, they're going to say, oh, I have anxiety. Here's 500 different solutions that could possibly help me with my anxiety, right? If they try one and it doesn't work for them, they should have the right to be forgotten and to move on and try a different solution that could be helpful to them. But I think it's going to, as Patty said, be an increasingly hot topic. And I think any platform, moving forward in a digital transformation environment is going to have to think about identity, security, privacy, and informed consent in plain language English, or I think that they lose trust of the communities that they serve.
Yeah, if I may stay on that for a minute, I think this is going to be a super important topic, as you rightly mentioned, Kristen. And the heart of this is, I think, the monetizability of consumer medical information, which is a very, very attractive thing from a business standpoint for a lot of entities. And we recently now I've come across cases where for some of the digital health solutions companies that of the 300,000, some, if not many, have built their whole revenue models around the monetizability of the data that they're accessing. Now, I applaud you, Kristen, for pointing out that you've got all these guardrails around who gets access and things that you will not do with patient data, and I applaud you for taking that position. But unfortunately, there's a lot of startups, a lot of companies out there. For them, the revenue model is based on monetizing the data, and that can create a friction point right there and then. Now, on the other side, since we're talking about unified patient portals and so on, you would have seen recently there's this huge kerfuffle about some plugin from Facebook that's on patient portals installed by health systems that is surreptitiously gathering information about these patients and passing it back to Facebook. And there was a news article about, I think it was earlier this week. So if these plugins are being put in with the active consent of the health systems, so health systems are also party to some of this compromise of patient data. And today, HIPAA is, I think HIPAA probably needs an overhaul. What it protects, what is, how consumers can be identified through data that is non-medical data and linked in some way to their medical history is very, very easy in today's world of the advanced data science capabilities that we see all entities building. So this is going to be a complicated issue. It's also going to put a lot of consumers in a very compromised position. A consumer who comes on a portal and is searching for a doctor for a particular condition, and that information about that search for that condition is getting passed to a company like Facebook. Not a good situation.
No, and that's why I think informed consent is going to become super important. And the only other thing that I'll say about that, and then Imran, I know you have a comment, is sometimes consumers want to monetize their data, but I believe it should still be their choice. And so when you think about a consumer who might have a very complicated, my family has a very complicated medical history. And we always like to say, if anything ever happens to us, we'd love to donate our bodies to science for somebody to study, to try to learn faster from it. That's been just a term in our family we've used a long time. But the reality is that if sharing the medical record of our family lineage could help to, diagnose someone faster, and if, let's say, pharma wants to research new medications and drugs based off of our family history, then we should have the right and the choice to say we want to either donate our data or we want to monetize it. We want to be reimbursed for it, but we want to contribute. So I think, again, it's going to come down to consumer trust. And I firmly believe that today's consumer who is digital first is not going to tolerate or put up with the backdoor sharing of, information without their consent. I think that they will stop utilizing those companies. But I think companies that do things the right way have the ability to not just assume that, they can monetize everything, but I think that if they give consumers choice, that consumers will actually be drawn to those companies because they're going to feel like they're in control of who sees their data. Imran, I know you wanted to add something.
Yeah, I just want to double down on the informed consent part, right? Today, health systems are making decisions on behalf of consumers. The example Patty is using is that the health system made a decision on behalf of the consumer to share the data with Facebook. And as a consumer, I did not actually have a choice in that matter. So as we don't want health systems to be making choices for consumers in terms of security and privacy, I think we want the information and let the consumers make the appropriate choice that's right for them.
Yeah, Kristen, you mentioned a very important word. It's trust. Traditional health systems have built a trusting relationship with their communities that goes back 50, 100, 150 years, right? Today, there is a risk that some of the trust could be compromised because of exactly what we're discussing. In a more immediate term context, the effectiveness of these digital programs that many health systems are investing in could be compromised if consumers don't trust these digital features. So in the example that I just talked about, if people don't feel confident that they can go in and put in a search on a portal for a medical condition and look for a doctor, because that data could be passed back to somebody that they don't know about, they're not going to use the portal for that search. They're not going to use the portal to schedule an appointment for that condition. They're going to try and call in or find some other way to do it if they feel that the portal cannot be trusted. And so for your business, Kristen, this may have some implications, right? What health systems choose to do with their privacy policies and so on is out of your control, but it's something you could influence or possibly educate them as well.
Yeah, we've actually taken the position of writing and annotating a new, what we believe future of healthcare terms of service and privacy policy should be. We've annotated it and published it widely for others to use against everything from HIPAA to GDPR to the Karen Code of Conduct and other best practices. And we do believe and have been very successful in influencing our customers around how to think about privacy and security, because the reality is that the war to, or I would say, we'll call it a war, right? The war for consumer loyalty in healthcare has begun. And there is a race afoot, and there's a lot of people who can win that war. But I'm very optimistic that health systems and retail pharmacies and others can actually win that loyalty and trust, because they're starting with more of it than tech companies when it comes to their healthcare. But they have a long way to go in order to provide the kinds of digital experiences and conveniences that are necessary. But consumers do trust their doctors more than they trust big tech, and more than they trust their insurance carriers. And again, I think insurance carriers have a huge opportunity right now to jump in and be the connector for all of this information, just like providers can, and really navigate from a simplicity perspective. So, I'd like to see the healthcare system really step up. And Patty, you already talked about the huge sense of urgency. We now know that recent studies are showing that instead of being at 50 or 60% of people focused on this, it's now 100% of healthcare executives thinking about the digitization and the consumerization of healthcare. But we also know that 40 to 50% have a plan or have even started. So we are just at the infancy of where digital transformation is going. And I think some of the best practices and more that we can share will help all boats rise with the tide, because we don't think everyone should have to go solve each of these problems. And that's why we always start with the fundamental basics of, let's talk about terms of service. Let's talk about privacy policies. Let's talk about informed consent and how to win loyalty, because at the end of the day, the lifetime value of a consumer from a healthcare perspective, should they choose you, is worth significantly more than what most healthcare stakeholders are making today.
And these privacy and security things are not restricted to portals, right? Today, your data is being shared with other entities that you don't know of. So the portals haven't opened up anything new that did not exist in healthcare before. We do have to address this transparency to consumers and letting them make their own choices, regardless of whether they're using portals or not.
And we have a few people who are actually wondering, at the end of the day, we're talking a lot about consumers owning their own data. So what's the opinion around the patient aggregating their own data to actually put together, to Patty's, quote unquote, golden record? So is it the patient that has that responsibility? Is it the enablers? What do you guys think?
Well, I think the golden record, today, the golden record is really the prerogative and should be a priority for the health system, especially integrated health systems that are serving members and patients and potential patients / consumers. And creating that identifier is, to my mind, table stakes. You've got to create that identifier before you can do anything meaningful with it. Now, it's not that they're not doing meaningful work with the current state of the data, but I think to really transform the organization and to realize the full potential of all the digital engagement capabilities, whether it is for providing improved access to care or whether it is for delivering better care and driving better outcomes. I think the golden record is increasingly clear that the golden record is table stakes. You got to have it in place, because there is no national patient identifier. If we had a national patient identifier, that would be a whole different matter, but that's not happening anytime soon. So you have to create your own identifier within your own organization. Now, can consumers aggregate their own data and do that? Yeah, they could have, and it was called Microsoft Health Vault, and it doesn't exist anymore. It was called Google Health. It doesn't exist anymore. That experiment has been tried by other tech firms. It hasn't worked. So it's now incumbent on the incumbents, namely the health systems, to create that golden record and enable patients and consumers to use that in meaningful ways.
It's
Yeah.
funny.
So I
I
think
have a slightly different perspective on that, only because, as a mom to a child with multiple, chronic conditions and having tried to collect health records for a family for a very long time, I think putting the burden on a consumer is really difficult. If you've tried to collect your records, you have inevitably come up with some hair pulling stories of just nonsensical processes, that consumers really have to go through. I think that the, ONC and CMS rules around information blocking and interoperability were really they're what I like to call the sentinel event that changed healthcare forever that no one saw coming. And the reason I say that is because for the first time, the technology standard by which to use, and in this case, an open API, was dictated in the framework of the regulation. And we put some not we, but the industry put some pretty stiff penalties around non-compliance. But the key part was that consumers could choose any healthcare application of their choosing to operate on their behalf with their patient right of access to collect and aggregate that data. And I will tell you that even that process is in its infancy, but we have very high hopes for FHIR being the standard by which healthcare data will, interoperate across not just the country, but the world. And when you think about the fact that consumers can delegate to a company like a BeWell and say, hey, please go get my data. Now, it's not 100% comprehensive data, but it is becoming a lot more mature and we're getting more and more data accessible. But consumers have the ability to direct an application to do that. Now, if we ask the consumer to go figure out how to register, with every payer and every provider in this country, it would be quite daunting and difficult for them to do that. And so having advanced patient matching and other things, to your point, Patty, if you're going to have a golden record, table stakes is having the ability to be able to normalize data and execute, because anyone who operates in healthcare data knows exactly how complicated and difficult it is. And so I think having trusted third parties, and whether that trusted third party is an independent organization like a One Record, or if it's somebody that is a health system or even a health payer that is now helping the consumer to leverage their patient right of access, but doing the technical hard lift and the normalization, I think, in my opinion, where Google Health and Health Vault failed is a lot of reason that people are also not largely using, their health records in terms of their Apple connection and watches, which is that we're connecting data and we're pulling it back and we're showing it to a user in exactly the way it comes across. But healthcare data was never meant to be consumed by the average human. It was meant for billing purposes. It was meant for documentation and audit. It was meant for care between physicians. And part of the administrative burden causing burnout is all of the additional requirements that people have to document inside of these records. But the reality is, if you can pull in the information into a golden record, but you can then take the next layer to translate that normalized record into longitudinal trend lines, wrapping useful information like, what is this lab? What part of the body is it testing? Why am I being measured? Is there any test preparation ready? What are the normal and abnormal ranges? And what do I do? But with fact-based, evidence-based guidance, you can start to actually help improve the health literacy from a healthcare perspective in this country. And I think the more that you can educate consumers in data that they've never had accessibility to and they've never been able to understand, even when they do, you can actually get them to start taking actions on that by showing them their own data and what that means. And I think we have to take that step forward.
I think
I'll say one thing though. I'll say one thing, Kristen. I'll hand this back to you, Imran, in a second. You mentioned Apple Health Records. I'm a big fan of Apple. I have an Apple.
I am too.
So, and I get all my data. I love the fact that I'm able to pull. I'm connected to my PCP. I pull the data from the PCP. I have all my exercise data. It's on my watch. God forbid I have an accident. Somebody can, pull up my phone or my watch and get my emergency information, my blood type, etc., etc. Interesting part is I can't show that to my PCP. My PCP won't look at it, right? So what is what good is it if I have all of this information that I'm gathering about exercise, all my other lifestyle data, but if I can't use it in a clinical context, right? So I think we need to overcome that challenge as well. So giving consumers the ability to aggregate information from multiple sources is a great idea. I think making it actionable means that getting your physician to accept it and use it in their diagnosis and treatment. And there's a couple hoops that we still need to go through.
Yeah, and I think
Yeah, I
I'm
think
optimistic because some of our customers are doing that now, which is great. Go ahead, Imran.
Yeah, I was going to add a couple of thoughts. So one is, having created golden records for about a third of the country's population, it's a really hard problem. Because if you look at the names are very different across various data sources, the type of data. So one of the keys to success is getting the consumer engaged in this aggregation process, because they actually are already authenticated with the various entities and can bring the data together. And I think the other part is, Kristen's absolutely right that as a consumer, I don't really care about seeing all my blood pressure readings and all my lab tests. What I really care about is, how can I and my family be healthier, and how can I save out-of-pocket costs on my healthcare? And it's really translating the data into those insights is really what consumers care about. And then that's the bridge that hasn't been crossed yet. And once that is crossed, then consumers will actually get value out of the data instead of just looking at all their readings.
Yeah, absolutely. And on the topic of that, I mean, there was a health insight study that just came out a couple of months ago that actually shared that consumers, overwhelmingly, there's 84% of them, of people who want their providers to be able to use that data, Patty. They want to be able to show their phone and their something and just be able to share, that they had a telehealth appointment, that they went to CVS to go get their vaccination. They want to be able to do that. And so just meeting those demands and those expectations, I think, is where we're going to end up, closing out this session of, we've talked a lot about consumer demands and where the market is and, everything that's going on in the marketplace right now. But to that, 50% of people that Kristen mentioned that might not have started in their digital transformation journey and are still trying to plan towards what to do, what are some real tangible solutions and outcomes that they can focus on, where, whether it's talking a little bit about value-based care and where the industry is right now. I know, Imran, you have a lot of experience with our clients and the outcomes that they're seeing. And so I'd like to do a little bit of round robin around what can actual organizations do to help deliver the almost expectations. What are some things that they're not thinking about? And so let's start with Kristen, if you don't mind. And then we'll go to Imran and then Patty.
So Nisha, I'm going to call myself on the carpet. There was some really good information going on in the chat that I was engaged in. So I'm going to let Patty go first and I'll go next.
All right. So I will say, this is this is kind of what we do as a firm, really help health systems figure out their digital roadmaps and their digital strategy and so on. I think it all starts with really understanding your patient population, understanding the personas that you're trying to serve, and then working into the digital enablement priorities that as an organization you need to be thinking about. Remember, there's 100 different things you can implement from a digital enablement standpoint, but you got to pick the 5 that are the most important for you this year. Make sure you're funding it, and make sure finding the right technology partners to do it, but also make sure that you're internally set up for success. A lot of organizations say, "Oh, okay, I'll call this vendor, and I found this cool solution, and I have the budgets, and let's go start." Well, hold on. What do you need to be thinking about internally to support it? Integration, data, just a couple that come to mind right away, and whether you have the ability and the bandwidth on top of everything else that you've got going on. So having a sense of priorities, having a clear line of sight to what is important for your patient populations, and then backing into the technology and the technology enablement. That's kind of how I would recommend. That's how we recommend going about it with our clients.
Yeah, I think Patty's exactly right on the money. We tell people all the time that, digital transformation is as much a cultural shift as it is a technology shift. And if you are not set up with governance and appropriate governance to escalate, you're not going to be successful regardless of the priorities that you set, because we're effectively telling an entire industry that's operated in a certain manner for many decades to, for the first time, change the way that they do business and to think differently about how to manage everything from scheduling to interactions to automation of, post-discharge and pre-visit forms and, how all these things work together. New digital adoption of tools to help with diagnosing, or tools that can layer on top of an EMR to do NLP. There's so many things out there from an innovation perspective, but you've got to be able to prioritize. And so we help our customers first establish OKRs, objectives and key results. What is it that they're trying to accomplish? How are we going to align the priorities to those objectives in order to deliver key results to help continue to fund their digital transformation program so they can show an impact right out of the gate? But where we have found programs that fall apart or don't move as quickly as they really want to be moving is because they don't have the governance structure set up for transparency to bring the whole organization along. They don't have the meeting cadences to showcase decisions, priorities, blockers. You're going to encounter them. You're going to need help breaking them out, and you're going to have to resource for them. And if you can get those things up and you have, kind of centralized commitment and buy-in, the more you move into an ongoing cadence, the more successful you're going to be because the expectation is set. So we've actually, much like, Patty's organization and many others, we've had to create digital transformation playbooks that allow for our customers to understand what is a best practice in terms of how to organize yourself, how to document, tools, to manage the projects, how to prioritize, how to write OKRs, and then how to organize your roadmaps and prioritization underneath those OKRs to ensure success. And how do you take data from being the caboose and the train to being the engine? How do you measure and monitor the impact of everything that you are doing? Because as Patty opened us up today with, not every feature that you put in place is going to work. You're starting with a hypothesis. And if it's only one, feature or function or one pathway, not everybody follows the happy path. Sometimes you have to create multiple pathways. And so if you're not measuring that from the outset, you're not going to deliver the ROIs that the organization is anticipating from you. So helping healthcare, which has been traditionally a waterfall approach to technology, move into an agile format and understand the tracking and traceability of data is going to make them a lot more competitive with those big tech entrants and how they operate. And it will help them move more quickly. But I would start with, how do you, who is the champion in the organization? Do they really have authoritative power? Do they have budget and resource, allocation across the organization? Because digital transformation touches everything. And then do you really have a framework or a playbook that you can put in place to ensure your success when you start? So we offer all of that as additional services to our clients. I know Patty does the same thing as well as many others. But I think we're all kind of learning and seeing the same best practices, and happy to share those with anyone just getting started.
I think a couple of things we've learned to add to that is, one is finding areas where there's a benefit to the organization and a benefit to the consumer at the same time. Right, so like you take an example of scheduling. There's clearly a benefit to the consumer that they can book appointments online. It's more convenient. They can reschedule and they can fill out their paperwork. But it's also beneficial to the health systems because they get less no-shows. They get more people going into the right provider environments. So finding those places where those things connect is really important. And the second thing we found is having the right incentive structure in the organization, because it's pretty hard to get the whole organization to move as one. But if you have the right incentive structures where, if there's incentive for providers to open up themselves to online scheduling, then providers can do that and actually get those benefits where other providers may not do that yet. And then the organization doesn't have to move as one, but can actually move in stages.
Yeah, thank you, everybody. We have come to the end of our session, which just seems ridiculous to me because it feels like we could keep going on today. Patty, Imran, Kristen, it was wonderful chatting with you. And I think in general, what we've realized in the past hour is that we need to provide the best level of care for consumers to help meet their demands. But right now, we can only understand a subset, which is about 20% of a person's data that's through, the EHR portals and digital front doors. So what does this mean? It means that we need to come together as an industry to help address the siloed data so that we can really deliver on that 360 degree of a person, and ultimately give consumers what they want, choice. And so before we sign off today, I'd like to end this session with just a quick poll. Be Well offers a connected health platform, a unified consumer health product, and it focuses on transforming all of the fragmented data, including third parties, from any source into a meaningful experience, not only for the consumers, but for the organizations as well. And so please let us know if you want some additional information on Be Well. To the team, thank you so much. This was a great conversation. I appreciate all of the input and insight, and I'm sure our audience feels the same exact way. Thank you all, everybody.
Thank you so much. Thanks for having me.
Thanks,
Thanks, folks.